Hello, everyone. Welcome to another session of Living Sickle Smart. I'm so glad that you joined us on this beautiful summer day. We have a special guest for you, of course. So we're excited that you are here. The first thing that I want to do, though, I want to make sure that I give a huge shout out to our sponsors and supporters. So let me just go ahead and share my screen really quickly, because I want to make sure you all know who is supporting this great work that we're doing and why it's so important. So of course we have Dr. Lemitra Scott here today with Breaking the Sickle Cycle, but we are also grateful to Beam Therapeutics, Agios Children's, Minnesota, Be the Match, and the Sickle Cell Data Collection Project that's happening here in Minnesota. These individuals have really helped to make the activities, events, and the programs that we bring forth possible. Today's session is going to be incredibly special. As many of you know who have been with our SickleSMART sessions before, the SickleSMART session is part of our education and awareness program, and we bring it to you live and on demand. So what's exciting is that for those of you who are attending live, you're going to see it live. You can participate in the Q&A, by the way. Add your Q&A questions throughout the session. That Q&A button should be at the bottom of your screen, but feel free to comment anything else in the chat. But you can visit our website to learn more about us, Sickle Cell Foundation of Minnesota. Again, I'm Ray Blaylark. I am the executive director. We also have a quick links page if you're just looking for something specific, typically our programs or a quick link to an event. You can pull it up that way. But our YouTube channel, so important. That is our repository of all of our videos, both SickleSMART videos as well as some of our Sickle Smile live broadcasts as well. And then if you want to sign up to get notifications of whenever we upload a new YouTube video, or whenever we have a new event, you can go to Eventbrite as well and subscribe to our channel. So without further ado, I want to stop sharing first. And I want to introduce someone who's very special, not just to me, but to the entire sickle cell community. What I love about this show is that we look to identify people within the sickle cell community who are connected in some way. So whether they are a patient themselves, whether they are a caregiver, whether they are a provider, whether they are a stakeholder, right? Stakeholder is who cares about the outcomes of what happens to us as a community. You know, that is a bigger piece of our community. When we say community, it's important that we include the people who care about our outcomes. We don't need anybody who's going to be on the outside looking in. We're on the inside looking out, and we're all working together to make it better. So that's exactly who we have here today is Dr. Lemitra Scott. Like, she's a double whammy, y'all. So you know what? She's a triple threat. Let me put it that way. So not only is she the mother of a warrior, but she also is the executive director of her organization, Breaking the Sickle Cell Cycle. And this third threat, she is a pharmacist. So she can bring us information and bring it to us in a way that only a warrior mom and an executive director of a community-based program, community-based organization, as well as someone in the healthcare space. So y'all know I come out of that healthcare space, and so I definitely have an affinity for that. But without further ado, I want to introduce to you Dr. Lemitra Scott. Add your questions as we throughout the session, and we will ask them at the end. So take it away, Lemitra. Tell us a little bit more about you before you begin. And you might be on mute.
Okay, it's only been 2.5 years in, and I still forget to push the unmute button.
We all still do it.
Well, I do want to say thank you for the invite. I'm welcome to be here. It's an honor to share information with the sickle cell community. Your introduction made me sound like I was some person that needs to be on a Hollywood square or something.
Yeah, advocating for sickle cell.
Right. I'm a Hollywood sickle cell advocator. Yeah, I'll take it any day. Anytime that I get a chance to talk more about sickle cell disease, and especially combining that with my professional pharmacy, it really is a life-changing experience. And I hope today to share some information with your viewers and everyone who is participating about things that you just don't really think about when it comes down to sickle cell disease in the normal course of day-to-day activities. But these are actually things that can be the defining factor between being in a hospital and not. So without further ado, we will go ahead and get started with the slides. So hold on just a second here and I'll get mine pulled up. Okay, here we go. So how a good pharmacist can save your life. And by the time we finish, I think you'll be saying how a great pharmacist can change your life. I do want you all to know that the information being presented here is not intended to diagnose, treat, cure, or prevent any disease. The information is only for educational purposes. So that's my disclaimer before we get started. So today we're going to talk about exactly what and who the pharmacist is and what roles they actually play. We're going to review some of the safety associated with over-the-counter medications. So that's what OTC stands for. We're going to discuss the risk associated with common OTC pain medications and look at some of the best practices associated with discarding medications that are no longer in use. And we'll look at different types of drug interactions among common herbals and prescription medications as it relates to the sickle cell community. So who is the pharmacist? I know all the time you may go to your local retail pharmacy and you may see the person standing behind the counter with a white coat on, and it looks like they're staring at a screen. And a lot of people think that that's all that they're doing is just staring at a screen. But there's a lot going on. A lot of life-saving, life-altering decisions are being made by the pharmacist that's standing there looking at the screen. So a pharmacist is actually a licensed healthcare professional with a Doctor of Pharmacy degree. It's called a PharmD. They are considered as the medication experts of your healthcare team. Oftentimes, your physician or the nurse may look to the pharmacist to give them additional information about a particular medication, wanting to know if this medicine is appropriate for this particular patient. In regards to any additional meds that they may be on, are there any drug interactions? But more importantly, even with that patient's particular disease state, is this medication appropriate for them? So that is where the pharmacist comes into play on your healthcare team. They have a specialized expertise about the composition of medicines, including their chemical, biological, and physical properties, as well as their manufacture and use. They're responsible for evaluating a patient's drug therapy for appropriate indication, the safety profile, drug interactions, and interactions with other consumed products such as food and alcohol, and a patient's response to drug therapy. So that's a mouthful. But what all that means is that the pharmacist is responsible for looking at different laboratory values that may have come back from blood work that is being done. And based on the laboratory values that are present, the pharmacist can know whether or not a particular medication will work for a patient, or if there are any adjustments that may be required to the dose of the medication that is being prescribed. This involves assessing the patient for medication-related issues, collecting and interpreting evidence, prioritizing the patient's needs, recommending, implementing, and monitoring adjustments of the pharmaceutical care plan. So again, a lot is going on if you are looking at your pharmacist that may be in your retail setting looking at a computer screen. That particular pharmacist has access to your medication history. So that pharmacist can know, just based on the types of medications that a patient is on, whether or not they are suffering with hypertension, diabetes, sickle cell disease. All of that is something that is indicative based on the medications that you're taking. So when a new medicine comes in, then the pharmacist knows whether or not that new medicine would be appropriate for you. So an example I will give you is looking at hydroxyurea. Hydroxyurea is associated with drug-drug and drug disease interactions. So you want to make sure, so the pharmacist has to make sure that when they're prescribed hydroxyurea, that they aren't taking other medications that may decrease the levels of hydroxyurea, because it causes the hydroxyurea to be metabolized faster than what it should, or if there are drug disease interactions. So when I say drug disease interactions, that indicates any other condition that the patient may have that may cause the hydroxyurea to not work as it should. So as we know, there is a significant risk with hydroxyurea in pregnancy. So that's something that the patient would possibly ask questions about if you are a female patient, wanting to know if you are pregnant, and if not pregnant, do you take any contraceptives? That may be a counseling point that the pharmacist may talk about in terms of taking hydroxyurea and making sure that you don't have any unintended pregnancy, because that medication can potentially cause birth defects. So then we go to side effects. Oftentimes people have aversions to wanting to use hydroxyurea because it says it, they say that it makes their hair fall out, or they may have GI or stomach symptoms from it, or they may feel that their nail beds may turn black. These are all things that the pharmacist would be able to counsel you on in terms of what to look for or what to expect if you were to start taking hydroxyurea. And then we get down to dosing. Hydroxyurea is a medication that is weight-based. So for a person who is taking this medicine and for whatever reason, it seemed to work perfectly, and then all of a sudden it may seem like you're not getting the same benefits that you used to get from hydroxyurea, the pharmacist can help you, begin to narrow down what may be the causes of your hydroxyurea not working as well as it did before. And that's because the effective dose of hydroxyurea is actually tied to weight. And if it's not dosed appropriately or according to the weight that's required for you, then you may not get those benefits that you once got from hydroxyurea before, if there have been any weight changes. And then we have the issue of adherence. Hydroxyurea is a medicine that some people think that once they start taking it today, they expect to be pain-free next week. Well, that's not how hydroxyurea works. Hydroxyurea actually takes about 3 months or so before you begin to get what we call the therapeutic effects from hydroxyurea. So if you are a new start on this particular medication, adherence is a huge factor in making sure that you get the positive results that you're looking for. And that adherence means taking it every single day, not taking it when you remember or things of that nature. Hydroxyurea is very sensitive in terms of how it works versus how it doesn't work. And you have to have the levels where they need to be in your body in order to recoup the benefits from it. So adherence is something that is very important. And that's a counseling point that the pharmacist would share with you on the front end, so that you wouldn't prematurely stop taking the hydroxyurea before time because you felt like it didn't work. So back to the role of pharmacist, just based on what I gave you with the example of hydroxyurea, that's just one medicine. So just think about all of the medications that are available or that a patient may be taking. All of what I just said is applicable to every single medication that's out there. That is what the pharmacist is responsible for, providing you with all of that information. So let's look at some over-the-counter things. That's what we're going to look at today, looking at over-the-counter advice for medications. So OTC medications are not free from causing harm. And I will say that again. OTC medications are not free from causing harm. Many people think that because you can go to the store, you can pick it up off the shelf, that is completely safe. There's nothing wrong with taking it. Nothing bad can happen. That is not true. And I'm going to go through a couple of examples to explain to you exactly why that is not true. OTC also includes your vitamins, herbals, and supplements. When used appropriately, OTC medications are safe and they are effective. So I don't want you to think that these things don't work, because they do. You just have to make sure that you are using them as instructed. So first and foremost, you want to make sure that you consult your doctor or pharmacist before purchasing an OTC product. So if you go to your local retail pharmacy, and most of them have a window that's labeled consultation, or a place where you can go and talk to the pharmacist one-on-one. That's what that window is for. If you have some concerns about an issue and you don't know where to start in terms of treatment or what you can do, you can go to the pharmacist and share your concerns with the pharmacist, and they will be able to guide you in the right direction. Whether you're talking to your doctor or your pharmacist, they also need to be aware if you have any allergies or any health conditions. And the part about health conditions is very, very, very important. Of course, when we're talking about sickle cell disease, but again, in situations where you have of hypertension. A lot of cough and cold products that are sold over the counter contain ingredients that can actually cause blood pressure to increase. So that's something that the pharmacist would need to know about before they advise you on taking any OTC medication. They need to know first and foremost if you have any allergies or if there are any health conditions that they need to be aware of. You want to make sure that you read the label carefully and follow the instructions as written. That is very important, because sometimes people may feel if one is good, two is better. That is not necessarily the case. If that is not the instruction on the label, you can actually get yourself into a lot of trouble when you start taking more than what is prescribed. So just make sure that you're looking at the label, follow the instructions. And you want to make sure that you do not take medicines with the same active ingredients. Cough and cold medication combinations, oftentimes they contain pain relieving medications like acetaminophen, which is Tylenol, or Ibuprofen, which is either Advil or Motrin. For sickle cell patients, this is very important, because sickle cell patients oftentimes are prescribed narcotic pain relievers like Percocet. Percocet has oxycodone and acetaminophen in it. So in that particular situation, if you took a cough and cold combination product because you had some allergies or you were having a cold or something, and it contained acetaminophen, and then you got acetaminophen in your pain medicine, well, guess what? Now you've just doubled up on acetaminophen, and now you're increasing your risk for having an adverse drug reaction if you do that in quantities that exceed what the maximum daily amount is. Same thing with Norco. Norco has hydrocodone and acetaminophen in it. Again, you want to make sure that you're reading the product labels for whatever products you choose to pick up on the OTC aisle, making sure that they don't have the same ingredients that some of your prescription medications may have. Another thing is that you only want to treat the symptoms you have. Sometimes when you look for Tylenol, you may find a Tylenol PM. Well, if you don't have any problems with sleeping, you really wouldn't want to take a Tylenol PM. If all you have is pain and that's all you're trying to treat at that moment, then you want to make sure you're only picking up a medication that is applicable to the symptoms that you have. The problem with taking a product like Tylenol PM in the daytime because you have pain is that you may get the pain relief that you were looking for from the Tylenol, but because it has PM, which is diphenhydramine, aka Benadryl, that causes you to be very sleepy. And if it's during the daytime and that's not a time that you want to be asleep, that may be a side effect that you're experiencing because you selected a product that had additional ingredients in it that were treating symptoms that you really weren't trying to treat. You want to make sure that you keep a current list of all the medicines that you take. This includes OTC and herbals. Again, once you go to your doctor, you go to the pharmacist and you want some advice on how to treat a particular condition, they really need to know the full picture of everything that you're taking. This also includes if you're using any CBD or marijuana type products, because those also pose drug interactions that the pharmacist would need to know about. So just be honest on the front end, and that could definitely save you on the back end from experiencing some unwanted side effects. If you are pregnant or breastfeeding, you want to make sure that you talk to the doctor or your pharmacist before taking any OTC medications. Always check the expiration date on the bottles. When the medicine is expired on the bottle, it's expired and you need to discard it. You don't need to keep it around for the just in case situations, because that is where you get into trouble of having unintended people take medications that probably aren't intended for them because they are yours, or something bad happening because a person took an expired medication. The next thing I want to tell you all is only use the measuring devices that come with your OTC products. This is so important, especially when it comes down to pediatric dosing. The tablespoon that I have in my house and the tablespoon you have at your house, they may not be the same size, but they both say tablespoon. So that's why it's so important for you to only use the measuring device that comes with the product that you have. That way you make sure you get the exact dose that is intended to be given. And especially if you are given a medication multiple times per day, you want to make sure that you get that exact so that you don't run into the situation of having drug overdoses. If the symptoms that you are aiming to treat with your OTC medications, if they seem like they're getting worse or it's just not getting any better, and you've been taking the medicine for a couple of days, I would recommend that you go and see your provider, not try to stay at home, wait it out to see if things get better. Because if you've already had a couple of days of OTC medicines down and your symptoms are still not getting better, then it's probably time for you to go to the doctor. And the last thing I want to tell you is that herbal supplements are not the same thing as over-the-counter medications. So again, looking at over-the-counter advice, the reason why I talk so much about acetaminophen and making sure that you don't get double doses or you don't go overboard in terms of what the maximum daily dose is because acetaminophen can cause serious liver damage if more than directed is used. This is so important in the sickle cell community because I know pain is chronic. Pain is something that many people have to deal with on a daily basis. So that means you may be taking some type of pain medication chronically. And over time, that can build up. So you want to make sure that you are using the least effective dose possible to manage your pain so that you don't get into that situation where you're causing damage to your liver. Severe liver injury, including cases of acute liver failure, resulting in liver transplant and death, have been reported with the use of acetaminophen. You want to make sure that you keep your total daily dose at about 4 grams per day to limit the risk of acute liver failure. And if possible, you want to try to stay less than 3 grams per day, especially if you're in a situation where you find yourself having to take a pain medication daily. And once again, those maximum daily amounts, they are inclusive of all acetaminophen containing products. So if you have oxycodone or you've got some Percocet at home, then that Percocet in combination with any other medications that contain acetaminophen, it all adds up. So you want to make sure you're not going over that maximum daily dose. Another important factor here is do not drink alcohol while taking acetaminophen containing medications. This is important because the liver is responsible for breaking down that alcohol, and the metabolites that come from the alcohol being broken down, they actually can impede your liver or block your liver from doing the job it's supposed to do, which is, in this case, breaking down the acetaminophen. And if your liver can't metabolize it or break it down, then guess what? Those acetaminophen concentrations begin to build up in the body because the body is not able to get rid of it because the alcohol is affecting the liver's ability to work as it should. And now you run into the situation of acetaminophen toxicity and overdose. So again, do not drink alcohol while taking acetaminophen containing medications. In the sickle cell population, it's not advisable to drink alcohol anyway, because alcohol can precipitate dehydration. So again, and dehydration can put you into a sickle cell pain crisis. So that's why alcohol is typically a no-no as far as it's concerned in sickle cell disease. And if that is something that you partake in, then you want to make sure that you are hydrating with water as much as you can. So now we're going to talk about ibuprofen. Ibuprofen is a type of non-steroidal anti-inflammatory drug. It's commonly prescribed as an analgesic, which is a pain medication, is an antipyretic because it helps to reduce fever, and it is an anti-inflammatory agent. So you get like a 3-for-1 when you take ibuprofen. Ibuprofen can cause adverse gastrointestinal or GI effects, and they can range from dyspepsia to life-threatening upper GI hemorrhage. That means that you have some bleeding in your gastrointestinal tract, or viscous organ rupture. Symptoms include nausea, vomiting, dyspeptic symptoms, and abdominal pain. So if you start feeling like you've got what's called acid reflux acid reflux disease, or you're feeling like you've got some really bad heartburn, those are all gastrointestinal symptoms associated with the use of ibuprofen containing products. Typically, when you use ibuprofen, if you keep the dose less than 100 milligrams per kilogram in children, you're okay. Ingestion of more than 400 milligrams per kilogram in a child is associated with serious or life-threatening toxicity. So again, making sure that you only use the measuring devices that come with the products that you're purchasing. Make sure that you don't run into that serious side effect or life-threatening toxicity piece. And then when it comes to adults, the maximum dose that you want to use here is 3,200 milligrams of ibuprofen if you have it prescribed. And if you're using over-the-counter products like Motrin or Advil, or the store-branded ibuprofen, then you want to make sure that you're staying around or less than 1,200 milligrams per day. So looking at the disposal of expired medicine. So you want to make sure that you safely destroy expired, unused, or discontinued medicine. And the government, the FDA and the CDC, they've got a lot of great instructions out there on how you can get rid of expired, unused, or discontinued medications. If it's something that you have in your community or in your pharmacy, most of them have drug take-back programs. That means you can go to your local pharmacy and they have a little station set up where it looks like for me, it looks like the mailbox or the blue one, like the US Postal Service, where you can just open the door up and drop your used medicines or unused medicines that you don't want anymore. You can drop them in there and that pharmacy will discard them for you. That is one way to get rid of your medications. But if you don't have a drug take back option readily available, then you can actually destroy it at home. You can first make sure that your medication is not on the FDA flush list. If it's not on the FDA flush list, then you can put it in a Ziploc bag and you can put it in with coffee grinds and grind it up, or some kitty litter or sand. The most important thing here you want to do is make sure that whatever you're throwing away, you want to make sure that it's not in a form that somebody could retrieve, take out, and use it again. That is where we get into trouble with people getting overdoses of medicines, or harm being caused to people because they're reusing medications that were intended to be discarded. So first and foremost, look at the FDA flush list first. If your medication is not on the FDA flush list, then you can just discard it in your trash can by putting it in a Ziploc and mixing it with some undesirable product, and then just throwing it away. If it is on the FDA flush list, that's typically opioid type medications, then you want to make sure that you immediately flush those type of medications down the toilet. Opioids are anything that contain like the oxycodone, codeine, hydrocodone, Percocet, Norco, Loratel. If you have any of those medications, those are all things that need to be flushed down the toilet, because you don't want to throw them away, even though they may be expired or you may not be using them anymore, because you don't want to contribute to the opioid crisis and people getting access to opioids that weren't typically intended for them to have. So that's what I'll say about discarding unused and expired and discontinued medications. Just make sure you do it in such a way that it cannot be easily retrievable. And HIPAA is a real thing, and people try to steal your personal information. So you also want to make sure that on your prescription bottles that you're scratching out your identifiable information from the bottle before you toss them in the trash. If you can peel the label off, do that. But if you can't peel it off, then make sure that you get a Sharpie and make sure that you scratch it out so that nobody can steal your information. So now we're going to look at common over-the-counter medications and associated side effects. So side effects are effects that medicines have on your body that don't help your symptoms. Most side effects are unpleasant, and a few examples are nausea, dizziness, or bleeding in your digestive tract. I just talked to you about ibuprofen, and ibuprofen is associated with causing that bleeding, or can cause intestinal bleeding. Sometimes side effects can be useful. For example, certain antihistamines, and antihistamines are typically medications that you would take if you have allergies. It's medications that dry up all of the mucous secretions, like if you have runny eyes or a runny nose or something to that effect, then it is something that you can take to help dry those things up. So certain antihistamines can cause sleepiness, though. This might be bad for people who take antihistamines during the day, as I talked about in the example of using Tylenol PM. But if you're taking an antihistamine at nighttime, this side effect might be helpful if you need to get sleep. Side effects are not the same thing as true drug allergies. Those are much less common. So drug allergies are things that develop if you took a medicine and you broke out in hives all over your body, then that could be a drug allergy. That's not necessarily a side effect from a medication. So now let's talk about drug-drug interactions. So the body processes every medicine differently. When medicines are used together, the ways they affect the body can change. This is called a drug-drug interaction. It happens whether they're prescription or over-the-counter medicines. That's why it's so important for your provider and the pharmacist to know what medications you are using over the counter before they prescribe you something, because you don't want to create a drug-drug interaction. It can increase the chance that you will have side effects from the medicines you're taking. The main types of interactions are duplications, and we talked about those before in terms of taking products that have the same ingredients. Opposition, these are medicines with active ingredients that have opposing effects on your body that can interact. This can reduce the effectiveness of one or both of the medicines. So for example, over-the-counter decongestants may raise your blood pressure, as I talked about with taking medicines like Sudafed. Sudafed can raise your blood pressure. So if you are taking antihypertensive medications or medicines to keep your blood pressure low, then that means that if you took a medicine to increase it, it's working in opposition. That's a drug-drug interaction. Then you may have an alteration where one medicine may change the way that the body absorbs, spreads, or processes another medicine. For example, aspirin can change the way that some prescription blood thinning medicines may work. So again, if a person is taking medicine to like Coumadin or warfarin, that's what it's called as well, you're taking blood thinning medications, and then you take aspirin, which is also a medicine that can thin the blood, then that can cause your blood thinning medication to appear to work a little bit better or more than it should. And that can cause a bleeding risk if that is a particular medicine combination that you're taking. So now let's talk about drug disease type interactions. And I want to talk about caffeine for a minute. Caffeine causes blood vessels to constrict. That means to become small cells to pass through. This can lead to what we know as a vaso-occlusive episode. Caffeine increases the rate of red blood cell lysis. So the rate at which the red blood cells break down is increased by caffeine. It increases the hemoglobin S sickling rate and the polymerization rate, meaning the rate at which the sickle cells that you do have the rate at which they begin to form into those long chains, it actually increases when caffeine is present. So in sickle cell disease, caffeine is not something that you want to consume a lot of by any means. And especially if you're having a vaso-occlusive episode, caffeine is not the thing that you should drink to hydrate with at any point in time, or products containing caffeine are not the things that you want to drink during a vaso-occlusive episode, especially, and just during your daily course of living. Again, caffeine is not something, or caffeine containing products are not the things that you want to go to. So you want to make sure that you try to avoid or limit caffeine drinks such as energy drinks, cola, and coffee. Caffeine causes you to go to the bathroom more often, which can precipitate dehydration. So caffeine works as a diuretic, causing you to use the bathroom more. And again, dehydration is one of the key precipitating factors that causes a vaso-occlusive episode. Caffeine also blocks calcium absorption, and this can precipitate osteoporosis, or the conditioning where your bones begin to get weak over time. And we all know how prevalent avascular necrosis is in sickle cell disease, especially, in the bones. So that is why it's so important not to consume caffeinated or products, especially in the setting of sickle cell disease. And again, caffeine is a stimulant, so it can interfere with your sleep. So again, if you drink caffeine, or you have a soda, and before it's time to go to bed and you're wondering why you can't get a good night's sleep, then caffeine is a stimulant. That's why. And when you don't get a good night of sleep causes you to feel fatigued. That fatigue causes stress. Stress can precipitate a vaso-occlusive episode in sickle cell disease. So again, caffeine is definitely something that you want to stay away from. And if all possible, you want to make sure that you're drinking more water instead. So now we'll turn to talk about herbal and supplement safety. Herbal supplements are not the same as over-the-counter medicines. They can be found in the OTC aisle, but unlike over-the-counter medicines, the FDA does not review them for safe use before they are marketed. Herbal supplements can cause side effects. They can interact with other medicines that you take, and they can worsen a health condition. So that's why it's so important to make sure that you are telling your provider and your pharmacist if you're taking any herbal supplements. So some common herbal drug interactions I want to talk about are these. The ones that we're talking about here, they're not all drug interactions. These are just some of the common ones. Turmeric, I know, is something that a lot of people use for its anti-inflammatory effects that it has in the body. And it actually can induce your liver enzyme. So that CYP1A2, that's a liver enzyme. And that can cause decreased levels of many antidepressants and many antipsychotic medications. So I talked to you before about different types of drug interactions. And this is where a drug interaction would come into play, because mental health is so important for all of us. If you are taking a mental health medication, then you would definitely want to get the best effects from that mental health medication. So that's why I decided to put turmeric here, because it can decrease the levels of your antidepressant medications. Then we've got golden seal. I know a lot of people, especially as you get into the cough and cold season, a lot of people want to take golden seal for cold and respiratory tract infections, allergic rhinitis, ulcers, digestive upsets. So it has been shown to inhibit two of the major metabolic enzymes, that's CYP2D6 and CYP3A4. I know that's a lot of detail, but that just all goes to show you that those are just liver enzymes. And those two liver enzymes are responsible for breaking down about 90% of medications that are taken. They have to be processed through the liver utilizing those two enzymes. So when you have those two enzymes that are being blocked, then guess what? The medicines that you're taking are not being broken down, but they're actually building up. And when those medicines build up in your body, it increases your risk of having adverse side effects. And then we've got St. Johns Wort. St. Johns Wort is promoted for depression, menopausal symptoms, ADHD, somatic symptom disorder, OCD, and a lot of other conditions. But St. John's Wort has been shown to be a potent inducer of the 3A4 and the PGP enzymes. And these also have a high risk of causing drug interactions because, again, these are some enzymes that are very important for metabolizing a large number of drugs that most people take. And if you don't have access, or if those particular enzymes aren't working, and in this case, the St. John's Wort causes those enzymes to work a whole lot faster and a whole lot more than what they should. So therefore, it's making the medicines that you are taking, it's making them go away so they can't even do what they're intended to do. This is important because St. John's Wort, it is an inducer of the enzyme specifically, I want to point out, for oral contraceptives. We all know how important it is, especially in the sickle cell community, if you are taking oral contraceptives to prevent a pregnancy and you're taking St. John's Wort, that is something where your oral contraceptives will not work as they should because the St. John's Wort is causing the oral contraceptive to go away faster than what it needs to, and it's not around to help prevent pregnancy. So it's strongly recommended to avoid using St. John's Wort with over-the-counter and prescription medicines because it is associated with so many different drug interactions. And this slide is just a resources for dietary supplement drug interactions and quality. So if you ever have any questions about any kind of supplements that you're interested in taking and you want to get some more information on them or find out if they're going to interact with the medicines you're currently taking, if you can just go to any of these resources that are listed to get the information you're looking for. So how can your pharmacist help? Pharmacists are available to answer many of your medication and supplement questions. Pharmacists can be your advocate to assist in relaying information to other members of your healthcare team. If you're trying to get a message through to your doctor, if you talk to your pharmacist first about medications that you have questions on or you need some additional assistance with, the pharmacist can get in contact with your provider and provider's office to get you the information that you need. Pharmacists are valuable clinicians who can effectively help you in the management of your health conditions, not just your sickle cell disease. So when you talk to your pharmacist and you talk about sickle cell disease, but you may have some other healthcare conditions as well, the pharmacist is somebody that can help you with those things. All you have to do is just go to that consultation window, and I'm sure they would be happy to get you the information that you need. So with that, I will answer any questions. I will stop sharing, and I will give it back to Ms. Ray for any questions.
So that, first of all, it was a lot of information, but it was so good. And so thank you. We have some really good questions that have come up. I have questions, right? But one of the things that I'm glad that you did, so for those who may be watching this who are like, well, she's not even really talking about sickle cell medications. You know why? Because rarely do any of us have one condition. We either have comorbidity, so more than one life-threatening concern, or we have co-conditions. So even if we have one condition, there's another condition. We all have those kinds of impacts. So that means we could be taking anything else, whether we have sickle cell or we don't have sickle cell. That's just a common thing. So thank you very much for even presenting it from a broader scope so that we can see it in the big picture. So one of the questions that was asked, I won't read the question because I think the gist of it is, basically, what if you fill your prescriptions at different pharmacies? Are pharmacies talking to each other? Do they have a history of your prescription history? How do they know so you can have an informed conversation, or so that pharmacist can be informed when they're talking with you?
Well, I'll say it this way. The pharmacist may not know if you use two different pharmacies. And when I say different, I mean two totally different. You got a CVS over here, a Walgreens over here. You may go to your grocery store for something. So if you are going to different places, they may not have your whole record, but wherever you go, if you're filing your insurance is going to kick it back and say, this person got a medication, if it's not the exact same thing, if it's something that's in the same category, same medication category, then your insurance will kick it back and say, this person got this prescription filled at X pharmacy, it's too soon. So it won't let it go through. So that prompts the pharmacist to go and ask you, hey, did you pick up a medicine or did you pick this up at X pharmacy? So that's one of the ways in which the pharmacist will know, but they may not have your entire profile before them because you go to different places. So it is in the best interest, if you can, to go to the same pharmacy or at least use the same chain. Because if you go to the same chain, then yes, your prescription information will follow you no matter where you go because all the chains are connected.
And that makes sense. I think what makes it a little bit more challenging is that, particularly if you have a small child who is on liquid hydroxyurea, let's say, and they need a compound pharmacy. Many of the community pharmacies aren't doing the compounds. And so it might be further from where you work or live, but closer to where your child gets their medical attention, or maybe it's at that medical facility. Is that just simply something that the consumer needs to take it upon themselves to make sure that they're sharing with their home pharmacy?
Yes, and I'm in that same boat because my son takes liquid hydroxyurea, which has to be compounded at a different pharmacy from where I go to get his regular medications filled monthly. But in my case, because I am a pharmacist, I know what medications to look out for or what drug interactions to look for. But if that is the case and you go to your neighborhood pharmacy for your maintenance meds, but you have to go to a different place for this one, I would say tell your regular pharmacist about the hydroxyurea if you have some that you get on a regular basis at your regular, neighborhood pharmacy, just so that they are in the know about what's going on.
And do all of your diagnoses show up for your pharmacist, or is that something,
they do now? They do now. Yeah, diagnosis codes are attached to, well, they have to be. They're attached to the prescription when it's processed.
Okay.
So at least the pharmacist will know what condition is being treated by the way the prescription is coming in.
So if you're getting your hydroxyurea at one pharmacy, but your home pharmacy doesn't know, then they may not know you have sickle cell disease unless you're getting pain meds and things like that filled there.
Right, especially if you're getting pain meds and that may be your only thing that you're getting. I would recommend having a conversation with the pharmacist so that they know. And that also helps them to keep your medicine in stock. If you go to the same pharmacy all the time and they know, it's just like when we have cancer patients. Certain cancer patients, they go to the same pharmacy every 30 days or however often they have to refill their medicine, and the medicine is already there in stock waiting for them because medication is stocked based on utilization. So if you are a regular at this particular pharmacy, then your needs are already factored into utilization for that particular site. If you are not a regular patient, then you may run into the case of getting to a pharmacy and they say, well, we don't have that in stock, and they may very well not because of the crackdown that has been placed on opioids that is very, very, very highly regulated. Yeah. And they are only stocking medications for basically, I would say the regulars. They may have, enough to supplement for if other people come in. But if you are going to the same pharmacy to get your narcotics filled every single month, then that gets your utilization built into their rotation. And they know you when you come in and what you're coming to get.
My son has had that issue where they did not have enough. They wanted to send us to another pharmacy. I was like, when's your delivery day? We would rather that it stay under. I mean, he's had literally the same pharmacist since gosh, pharmacy since he was probably 8 and he's 26. So I'm like, no, we just need to know when your delivery, give us what you got, and then we'll come back and get the rest. So okay, so really good question. I'm gonna hit this and quit this because it's a whole topic of itself. If your child is on liquid, don't assume that they can't transition to their pills. Kids, the older they get, the harder it gets. Let me just put it like that. But there's also a lot of reasons why they may have pill taking hesitancy. Talk to your physician, ask them for some solutions, talk to the community. We have all been there at some point, but especially if you're having to go to 2 separate pharmacies and it's because your child is having multiple medications, but they're a little bit older and they're still getting liquid, something to consider. All right, next question. See, I'm not even gonna go any further. All right, so the next question is, oh, I like this question, and I hope you hit on this well. So why is acetaminophen added to pain meds? It doesn't seem necessary.
Oh, but yes, it is.
Oh.
Well, acetaminophen is added to pain meds because the acetaminophen actually helps to lower the pain threshold. So what that means is your brain's ability to perceive pain. Acetaminophen lowers that, which allows the narcotic the ability to go in and do its job of creating that euphoric feeling of feeling good, that receptor that's in your brain. So therefore you don't get that pain when it does hit, it doesn't hit the way that it would had you not had that acetaminophen on board. So that's the reason why they use it in combination. And it allows you to use less narcotic over time, because if you've got acetaminophen already on board, it's bringing that pain threshold level down. So when you take your narcotic, instead of taking, let's say, 10 milligrams of a Percocet, now your pain level isn't that high, and a 5 milligram of Percocet may actually work better because you've got the acetaminophen there. So that's why it is used in combination.
So that is one of those things that is a really good reason to have a good relationship with your pharmacist, right? Because I can't tell you, but I spent almost 7 years or so in the clinical setting, and I had that conversation so many times. And it wasn't that the hematologist didn't talk about it, but they just didn't talk to it the same way. And so the thing is, there are some medications that have bad side effects when you mix them, but there's other medications that are complementary and that they actually help meds to work better. So it's just a matter of knowing what you take and which is which. And once you know what your pain meds are and your all of your medications, it's easier to keep track of that. It may seem like a lot right now, but start jotting it down, taking notes, and that kind of will help to remember it a little bit as well. All right, so I do have, it's a little bit of a follow-up question, but are there alternatives to combo pain meds such as Norco?
Yes, there are. You can actually take them independently. So you can get straight up oxycodone, which is oxycodone and nothing else in it. So there are individual ingredients that are not combos, and it just depends on your particular situation. And I know that every person is different and how they respond to pain is different. So, but to answer your question, can you get the agents independently? Yes, you can.
Yeah, and I would just add that as my son got older and he was managing his day-to-day pain, or when he would have home pain, I found that having the combinations made it a little easier on him, because he didn't have to remember what I took last and what time did I take that one, when do I take my next one. But being able to have it in a combination, he knew that what he had was his breakthrough, but he didn't have to worry about taking more Tylenol or taking more of something else. So that's a situation where it does help. But to your point, yes, there are those times that you do want to break them apart. Maybe you're intolerant of one, or you don't like the way that a certain one someone makes you feel, and you need to adjust that dosing. So I totally understand both sides of that.
And I will say this, when you get them in their single components, then you typically would take them more often, as opposed to if you got it in combination, you could get like a longer lasting effect of pain relief versus if you took independent oxy by itself, it may not last you 6 hours like if you would have taken a Norco. So that's the trade-off. Sometimes if you take a single agent, it may not provide you with that long-lasting pain relief because it's a single agent.
I've absolutely seen that. So, okay, what is the 4 grams equivalent in milligrams?
4,000 milligrams.
So we talking about 1,000. So every gram.
No, it's like one Tylenol has 325 milligrams in it. So just think if you took it like 8, that gives you the ability to take 8 to 10 tablets in a day and not exceed the 4,000 milligrams. So that's, and prior to, I forget what year it was, but it wasn't long ago that the FDA had all OTC acetaminophen products reformulated to only have it was the 325 milligrams in it if it was a prescription product. And then OTC products, it's 500 milligrams. So again, you got to make sure you're looking at your bottles, because if you pick up a Tylenol bottle and it has 500 milligrams on it, you won't take 8 of those in a day. So just make sure that you are looking at the milligrams that are on your bottle. Read your prescription labels and your OTC labels.
Yes. And in an age appropriate way, teach your kids to read their labels, so that they understand what they're taking, that they don't accidentally grab a wrong bottle as they get older and are better able to take meds. We're talking teenagers typically, but I've met lots of older teenagers who still weren't sure how to read their bottles and couldn't call for their refills. So another just side note. All right. Also, Google has a great equivalency calculator that's built into it as well. So you can use that on the fly. This is such a good question. And I want to acknowledge that this person is not alone. But I've unconsciously developed a habit of hoarding pain medication in case I need it in the future, especially since obtaining opiates has been harder lately. What would you advise to someone who's unable to get a fresh and timely prescription for pain meds after old prescriptions are past their expiration date?
I will say I do not advocate for anyone using expired meds. And that's where I will leave it. I mean, you have to do what's best for you. And this is where, having that relationship with your provider is super important, to make sure that you're able to get access or to get a prescription when you need the prescription. And if you have a regular standing relationship with your provider and not just, when you have a episode, I think they should be understanding of the fact of what you're needing. But I do understand why people, keep their meds, but that's not something that's safe. And especially, in the opioid crisis where we have unintended people consuming medications, it creates a safety risk, is what it does.
Yeah. I love the fact that you brought up that's another reason to have a good relationship with your physician. We recognize that not everyone has that luxury or that they feel like that's a reciprocal relationship. But if you got them pain pills long enough for them to expire, go see that doctor a little sooner and let them know you need more. And if there is concern that there is judgment related to you asking for refills, and it's obviously been long enough for your pain pills to expire, then reach out and get some advocacy support, because that may be a bigger conversation that needs to be had about your care and your providers that are seeing you. So I hope that answered your question. If not, let us know. And then, why is the maximum dose different for prescribed versus over the counter?
Well, over the counter, the medicine is only, well, I noticed for ibuprofen, right? Was that the question?
I'm assuming so.
Right. Well, ibuprofen only comes in 200 milligram tablets.
Right.
And when you're trying to make sure you don't exceed that 3.2 grams per day or 3 grams per day on ibuprofen, that's why the formulation is different. For prescription, you may get anywhere from 600 to 800 milligrams in one tablet. So that's why there is a difference. They're trying to make sure that you don't exceed what that maximum amount is. And typically, you could, if you did the math, you could have prescription strength ibuprofen at home.
You're just going to take a whole lot more pills.
Well, because the information that I share is not intended to treat, diagnose, or prevent any conditions. I don't want anyone to say that I told you to do something that was not on the prescription label. Follow your prescription at all times.
Absolutely. Yes. Absolutely. I appreciate that. No, it's you're talking right. All right. For turmeric, does it matter in which form you take it in order for it to cause a drug interaction? Wow, that's actually a good question. For example, turmeric tea, would that still be included as a drug interaction?
If you use it in amounts that are typically found in foods, like without overdoing it, like over supplementing, the amounts that you find typically in your food preparations is fine. It's when you start to look at supplements of turmeric, that is where you run into the drug interactions with your mental health medications. And I would advise, again, that's a situation where you want to talk to the pharmacist to find out what dose are you on as far as your mental health meds go, how much turmeric are you trying to take as a supplement, to find out if it's in enough of an amount that would cause an interaction with your mental health medications.
Okay, so that's a really helpful key point, because I think there's a lot of us that add supplements or different things to our tea, and how that interaction could happen as well. Mm-hmm. All right. Should you inform your pharmacist if you or your child are using medical equipment such as oxygen, nebulizer, CPAP machines, all of those types of things?
Yes, I would. And if you're getting your nebulizer, and the nebules that go in the nebulizer, most times they come from the pharmacy, and they have a record of it if you're getting them from the same place you get your regular medications.
Absolutely. Yeah, I totally agree. Anything and everything that has to do with your health that is part of ingesting medications, it's important for you to share with your pharmacist. So thank you. Okay, so I have a couple of questions. If you guys have any more questions, we have about 2 or 3 more minutes before we wrap up. But so over the counter and supplements, everybody's selling them and everybody's making the same claims. And, Amazon Prime is my best friend. And so do you recommend ordering supplements and over the counter through the mail, such as Amazon and others that might be selling them?
Okay, so let's start here. Over the counter, supplement products are not regulated by the FDA. That means I can make a supplement and sell it. You can make a supplement and sell it. Anybody that's watching can make a supplement and sell it. And there's no testing that's done on it. So even though I say my products have 500 milligrams of X, there's no testing. There's no test that I have to do to prove that my product has that. You can say that your product has 500 milligrams. Who's going to come back behind you and test it? It's not a requirement for herbal supplements. That's why you see so many products on the market. Now, when it comes down to which product do you buy, because it could be a lot of variability, even within the same bottle. That's what makes supplements so finicky. Even within the same bottle, the capsules have been found to have variable amounts of what the active ingredient is that's supposed to be inside of it, because there is no regulation for it. But we have certain companies that do go that extra mile, that even though the FDA doesn't require them to be tested, they do it independently. So sometimes you will see on the bottle where it will say guaranteed third-party testing certified. That means that that particular company has gone the extra step to have their products validated and tested. So therefore, when you purchase a product and it says you're getting 500 milligrams per capsule, that's exactly what you're getting, 500 milligrams per capsule. So when you go to purchase your product, you want to look for something that says it's been third-party tested, or you want to look for it to have a little seal on the bottle. And the seal will have CGMP on it. It'll have a little C and then the letters GMP in capital. And that means that this product was produced under certified good manufacturing practices. That means this product has been tested, what's in the bottle is in the bottle, and they've got certificates of approval to guarantee that. So when you say, can you buy products online and through Amazon? You certainly can. Just make sure that you're looking for a product that has certified good manufacturing practices associated with it, or it's something that says it's been third-party tested.
Thank you, thank you, thank you. And I'm going to wrap up with two things. Number one, if you was hoping we was going to talk about THC and CBD, that there is still a lot of research being done on there, and there are different schools of thought, and so it is continue to do your homework and be.
Oh, you know what, Ray? If you don't mind, I will share some information about that. I actually have a podcast coming up soon, Vitamin SC3. Stay tuned to the Sickle Cell Consortium's Vitamin SC3 podcast, because I do have a session coming up soon. It's called Puff, Puff, or Pass for CBD use in sickle cell disease. So I will say,
came up with that title, but I like it.
Well, it was something that I know is very important to the sickle cell community, and I know it's something that people are using.
Absolutely.
I will tell you this, there is some utility in it, and marijuana is not the same thing as CBD, and THC is not the same thing as CBD. So when you start looking at your product, you want to make sure you know what you're evaluating. What is it that you're trying to treat? Because if you don't want to get that euphoric feeling, then THC may not be for you. You may need to go down the route of using CBD products. And CBD products do have utility and usefulness in treating chronic pain conditions and a host of other things. I will tell you this though, smoking marijuana in any form is not advisable for sickle cell patients, because when you begin to smoke things, it causes you to have decreased oxygen carrying capacity because of the byproducts that are coming off from that smoke. Again, decreases in oxygen is what causes a sickle cell episode. So if you're going to use any of the marijuana or CBD products, I would advise that you do not consume it in smoking. I know that smoking provides an instant benefit because you get the pain relief really quickly, but it also could be a catch-22. So that's all I'll say, because I want you to make sure that you tune in to the Sickle Cell Consortium's Vitamin SC3 podcast, Puff, Puff, or Pass.
And we will start advertising for that and promoting that on our social media channels, as well as our calendar page on our website as well, because I do think that these are the topics that are not being regularly discussed, and that's what the Living Sickle Smart series is about. It's about all the stuff that falls between the cracks that ain't nobody talking about. So I love that. And then the last one, because I really want a part 2, and this is about metabolizing pain meds and pharmacokinetics. And so that field is blowing up, and it is important to remember that all of our bodies are not metabolizing is the word, but that means that we all get different effects from different meds in different ways, potentially. And so they're doing far more studies to better understand how an individual body, or even groups of people may use, their bodies may use meds differently, and that includes pain meds. So I hope you'll come back to do that, or you're going to do another session. If you're going to do a SC3 session, but we'd love to have you back for a part 2. We already have somebody that says this was really good and we need a part 2. I want to make sure that I tell people once again about today's session, that it will be available on our YouTube channel in about 24 hours. Give me just a chance to get it up there. Also, thank you so very much, Dr. Lemitra Scott, with breaking the sickle cell cycle. We have her website up here. What I didn't put up here is regarding your new podcast, but I will make sure that we are promoting that. You can find more information, however, on breaking the sickle cell cycle on social media, Facebook, Instagram, LinkedIn, or you can send an email directly to Dr. Scott as well. A couple more things just to end it up. We have, and actually this slide is too soon, but a couple of the things that we have coming up. We have a virtual cooking class, and we do live cooking demonstrations. But if you'd like to get some additional information about nutrition and kind of how we got on the nutrition bandwagon this year, we did a session early in the year with Dr. Kate Shafto about sickle cell and nutrition, things you should know. So we invite you to watch that session. We also had a really good session on sickle cell trait and all the things we don't know, but the things that we are seeing, and how to make sure that you are mindful of that. And then let's see. It's always important. We are at an all-time shortage of blood. Now we've been at all-time shortages before, but this is the all-time of all times. We also know that when there are shortages on anything, which groups tend to end up in the back of the line? Yeah, that's us. So not only do we need to make sure we are advocating that they don't deviate from protocols when it comes time to transfuse or to give blood, but we also need to make sure that we do our part to donate blood, to make sure that it's on the shelves. No, blood does not have a color, but the more often you are transfused, the closer that match has to be. And that match often happens within the same heritage group. So yes, Black blood does matter. All right. I'm not going to show y'all the video, even though I'd really like to, but just know it does matter. SCDAA has a pretty good video out. If you'd like to learn more about the importance of diversifying the blood donor pool, you know how they say we got an app for that? We got a SickleSMART session for that. So you can check that out on our YouTube channel as well. And then of course, be the match. There is a cure for sickle cell disease. It may not be for everyone, but it is for some, but it could be for more if there were more people on the registry. So we invite you to be a part of helping to increase diversity on the Be the Match registry. If you are Black or brown, that you are tremendously less likely to find a match on the registry. So again, we are the cure. We are the we. All right. And so we have to be involved, and who better to help spread that message throughout our community of individuals that look like us and have some similar lived experiences as well. Also, if you are a person living with sickle cell disease or you are a provider, please know that there is a Sickle Cell Warrior resource package that you can order. It's free of charge. It gives you more information about Be the Match, and it connects you to resources to where you can talk and ask questions about stem cell transplant and the matching process. As I said, if you're a provider, share this resource with your patients so that they too can take part in this. Other activities that we have coming up, I already mentioned our virtual cooking class that happens monthly on the 4th Tuesday. So it's coming up soon, y'all. And so we invite you to join us. That is open to the entire community. Listen, cooking for your health is a community health issue, not just sickle cell related. Also, we have our community wellness walk and talks. And so we have our final one on Saturday, July 30th. And then our actual walk for sickle cell happens on Saturday, August 13th. So join us and help us stomp out stigma. And we also created a platform for you to report to us your experiences with the healthcare system. Now, typically when we get online and we want to talk about something, we talk about only the problems, but this is actually to let us know when you're having both good experiences and not so good experiences. So we do invite you to take part in that. You don't have to be in Minnesota to take part, but what we want to do is we want to make sure that we are, when we are at tables where we can influence decisions and policies, we want to use real life examples of what is happening in the community. And we don't use names, so you stay anonymous, but it's important to share your experiences so that they understand that these are actual events that are being experienced by individuals living with sickle cell disease. So thank you so very much. And then last but not least, of course, please continue to support our partners and sponsors. As I said, Breaking the Sickle Cell Cycle, visit their website and social media, Beam Therapeutics, Agios, Children's Minnesota, Be the Match, and then the Sickle Cell Data Collection Program here in Minnesota. All right, that was a mouthful, y'all. Good Lord. I feel like a newscaster for a minute there. Dr. Scott, thank you so much. It was a pleasure having you with us on this session, and we look forward to you coming back. We hope that you will, but we will continue to support your endeavors, what you're doing. We continue to pray for you and your family, and all families that are living with sickle cell disease and impacted by this condition. Thank you again. You can check out our calendar of events. There's a couple of links now that are in the chat for you to learn more about us. All right, until next time, signing off. Dr. Scott, would you stay on for just a moment?
Sure.